Today's panel will focus on the impact of academic research on space management and design and the importance of data analytics for space planning. Panelists will share their thoughts on the implications of using technology for healthcare space and design programs and what technology can't replace: consensus building, decision-making skills, and the human connection. Our panelists are Mardelle McCuskey Shepley, who is professor in the Department of Design and Environmental Analysis and Associate Director of the Institute for Healthy Futures at Cornell. In addition is Rosie Adams. She is an MS class of 08, Director, Operation Planning and Design at Stanford Healthcare. And finally, Zig Wu, MS class of 11, Senior Program Manager, Space Management at Stanford Healthcare. Mardelle recalls that while walking down Forest Home Drive, someone ran out of the woods and asked her if she wanted to zip line across the gorge. Most impressively, this was exactly 5 minutes after arriving in Ithaca to teach. They must have sensed her adventurous spirit because Mardelle also rode a motorcycle across country and back while she was a PhD student alone. Rosie is thankful to Cornell for creating an incredibly unique program that brought together her diverse interests in space, anthropology, psychology, and design. She's also thankful that as a student she could walk everywhere, especially to College Town bagels. One of Zig's favorite Cornell memories is a picnic with DEA classmates at Cayuga Lake State Park in the summer of 2010. When not at work, Zig enjoys oil painting, exploring the Bay Area, and taking Louie, his American Eskimo dog, on long walks. Please join me in welcoming our panelists.
We appreciate everybody joining us this afternoon and listening to what we have to say about innovation, addressing a similar topic. We all have background in health design as well, and we'll elaborate on that a little bit more so you can understand how it fits into the context of this notion of impact of research on innovative design. So one of the things I do at Cornell is I teach a course called Art Plus Science, and the objective of the course is to convince students that art and science are the same thing. And not everybody buys into that at the beginning, and not everybody buys into it at the end either, but it's an interesting discussion to put out there. The idea behind this is that we need to bring both these approaches to everything we do in problem solving in this very complex world that we're trying to operate in. So as you see here, we talk about research on design innovation. Most people don't realize that there is now a strong movement to do what we call research-informed design or evidence-based design, particularly with regard to healthcare. And this really means we actually gather hard data on how people interact with space and use that to support the healing process and the activities of caregivers. So an example might be we're trying to create a waiting room. If you're in a waiting room with no windows, you have one experience of what time is like, and even the care that's provided, that's one experience. The other experience, when you have views outside, say, of a pond or some hills in the background, you actually perceive the healthcare you receive as being higher quality. So just to give you a sense of what that's about. So I thought I'd start by asking Zig to say something about how we all happen to know one another and a little bit about Stanford Health.
Sure. So what's happened was really pretty interesting. This was actually before my time at Cornell. I was just a fresh graduate working in Singapore for the government and working for the Ministry of Health at that time in 2008, I think, and Mardelle and her colleague was actually in Singapore for a conference, and I was contacted through one of their local contacts to actually give them a tour of nursing homes in Singapore. So I actually met Mardelle much earlier on before my time at Cornell, and she was then a professor at Texas A&M. And so it was actually at that time when I decided to go to Cornell to pursue my master's in facility planning with an emphasis on healthcare planning. And actually after Cornell, I was connected to Rosie, who we both shared the same professor, Franklin Becker. So that was how I actually got my first job. Rosie hired me through a consulting firm, Jacobs Engineering, and that was in 2011. Yeah, and so it's like 5-6 years ago. We both started working together for a few years, and then I sort of diverged. I went on to go into full-time consulting, working for various clients across the country, and then we somehow found ourselves back working together at the same organization at Stanford Healthcare. So I'm currently a senior program manager at Stanford Healthcare, and I'm working in the space management department. So what we do is really looking at how space is being assigned in a very space-constrained environment, such as a hospital. And my job is really to figure out what's the best use of the space and how to optimize space. I also manage a real estate space management system called Archibus, and it's used to really track and manage space and also do a lot of reporting for regulatory agencies. And so Stanford Healthcare is it's a multi-hospital system. It's the teaching hospital of Stanford University. I think we have a couple of hospitals now. We've just acquired a couple of other hospitals on the East Bay. So I think in total we have about 5, and we also affiliated with the Stanford Children's Hospital. And they have a network of clinics across the Bay Area, and also employer-based clinics across the country.
Do you want to add a few words about yourself before we talk about innovation?
Sure. So my department is an interesting sort of bridge between operations and design. And so our responsibility is to help really be a translator between the life of a clinician and what it's like to actually provide care to patients, and help to translate that into effective design solutions. And so it's really interesting sitting between and trying to talk the language of both both professionals. And so we're doing that right now as we plan to open a hospital expansion at the Stanford campus in all of the sort of operational planning and workflow planning for that the new hospital.
Okay, so I think we thought we would start by trying to define what we feel to be the core of innovative design. What is innovative design? By show of hands, who here in this room feels like they recognize innovation in design when they see it? So there are a few people. If I asked you, what about it makes it feel innovative, I think I'd get a variety of answers. From my perspective, it has something to do with the process you use for coming up to a solution. So what happens a lot in the business of healthcare is there will be something that has been a tradition for a long time. For example, single-room maternity care, or rather the contrary of that, maternity care where you start in one room, go to another room. You might start out in a labor room. You go to a delivery room, then you go to a recovery room, and you go to postpartum room. So that was the model. And there may be people here in this room who delivered children in that setting. Well, about late 1980s, we started doing single-room maternity care. And that meant that the whole birthing process happened in one room. But we resisted that in spite of the fact that we've known for a long time. People did not, at home, start in their living room, run to the bathroom, then run. So we actually realized that this was something that we might not, it was wasting the time of staff, the patient experience, the mother who's delivering the baby. She's about to have a baby, and they're going to throw her in the corridor and run her down the hall. It just didn't seem to make much sense. But when we thought about what we were trying to achieve, we were able to change that model and overcome some of the restrictions associated with people worried about insurance and things like that. So that's, the idea is you don't want to, when someone creates something that people admire, you don't want to replicate that per se. You want to go back to the idea that created that and then reinterpret it. So another example would be private rooms. That's pretty much the standard model for new hospitals. And the idea for having a private room in a hospital is that you reduce the possibility of having an infection, which is a huge issue, and also provides privacy. But then we look out the rest of the world. How many countries, how many hospitals internationally can afford to put a single patient in a room? So what do you have to do? You have to say, well, what was I trying to achieve here? I was trying to provide privacy and reduce infection. And you use that as the means of generating this new idea. So I'd like to say a few words. Just take me to that first slide with the Cornell Institute for Healthy Futures. This is a brand new organization. It's a year old this past November. And what it is a collaboration between DEA, Design Environmental Analysis, health, PAM, the Sloan program, and then hospitality. And people say to us, how is it possible that you could be, what are you doing together that it could be effective? How do you share ideas? And the nice thing about this is we're all interested in this common issue of wellness. Like, how do you bring wellness into a hospitality setting? And how do you bring hospitality into a healthcare setting? And by working together and having to adapt one another's frame of reference, we are forced to sort of drag ourselves away from the set of rules that we're used to following within our own profession. So it's been incredibly rewarding. You can see here that we have multiple initiatives, roundtables, conferences we put on, we publish, we have a minor that we're generating. And when we first put this course out there, this minor, this one credit course that was going to be in support of the minor, we had 60 students enroll within a 2-week period because we had to set it up very late prior to registration. So students get this, that we're looking for this interdisciplinary world. So I wanted to give each of you a chance to talk a little bit about what you think innovation is from your perspective. Why don't you start, Rosie?
Sure. I think what's been really interesting for me is we've been spending a lot of time actually planning a new cancer hospital at Stanford. And some of the most, actually if you go to the next slide, some of the most sort of interesting innovations have come from the fact that, first of all, we have a lot of constraints. We're trying to renovate within an existing space. We also have limited budget. And so we've had to really be selective about where we choose to invest money and how we are going to design and renovate this space. What we did was we just went out and spent time watching. You can see some of the photos here. We gowned up, we watched the housekeepers, we followed the dietitians, and we just sort of stood as a fly on the wall and watched what it was like to be a staff member, to be a patient. And it was incredibly informative, the details that we noticed, the small details that make a huge difference in people's daily lives. One of the most impactful observations was watching a patient, a cancer patient with an IV pole trying to take a shower. And the small limitation of the design of the shower required them to step up over a lip into the shower. And it meant that they couldn't fully get into the shower with their IV pole, and it was dripping all over the floor. That one thing had such an impact for the patient and such an impact for the staff member. And we would never have even thought to change that element of the design without going and just watching. And so I think that has been really powerful learning for me around how you can actually come up with some innovative design solutions.
So while actually the Institute for Healthy Futures actually was created, I think 3 years back, I was a student at Cornell 5 years ago, and I wish there was such a program at a time, but I actually minored in both the hospitality management program as well as the healthcare management program at Sloan program at within the College of Human Ecology. And I wrote a paper about how we can actually bring in hospitality design into healthcare as one of my, and that was really, I think, the pivotal point of my career at Cornell, where I was able to blend those kind of ideas together. I think what I would like to talk about is this example of a hospital in Singapore that I worked at, where I did my thesis on. It was actually a hospital designed really very differently, and it was a very, the CEO of that hospital is very visionary. He thought of the hospital more as a garden, and the hospital is sort of like secondary to it. So this design was, this hospital was surrounded by a big courtyard with lots of trees, and he had tried to incorporate a lot of natural species of animals and insects, because he believed that having living organisms within a setting like that could help with healing. This hospital was also situated right next to a park and a pond. So as part of the project, of the hospital project, he actually turned it into a health and wellness park, and people actually treated this hospital more as a destination to go and exercise and explore wellness and fitness. And there's also a rooftop garden in this hospital where they actually have volunteers growing organic vegetables using compost from food waste in the hospital. So I think this sort of sustainable perspective that was used in designing and creating this hospital is really innovative. And I had the fortune of actually working my thesis on this hospital, and while I was working at the Ministry of Health as well, helped to fund this construction project from the government.
Thank you. So Rosie, I'm going to pass this next question to you, at least to start. What technology is currently being used or trialed at Stanford Healthcare to improve patient care and experience?
So I think one of the areas that we are really interested in is how we can help to facilitate communication within the hospital. And so not only communication with care team members, but what's really interesting for patients who have long stays is how they stay connected to their communities, particularly because I've been doing a lot of work with our cancer patients. They so often are in the hospital for weeks at a time and they're coming in and out. And how do they stay connected with friends, with families? Often they don't necessarily want to leave their room. They don't always feel well, they don't feel like walking around. And even how can they stay connected maybe to other patients in the hospital? So we're looking at interesting ways to be able to allow them from the bed, from their room, connect through even just simple things like Skype and how you, so it doesn't always have to be complicated. It can sometimes be a really simple intervention, but just ways for them to get out of the room virtually.
And so you want to talk about wayfinding a little bit?
Yeah, so I've been working on implementing this space management system at Stanford, and you can actually layer upon floor plans a lot of data about where departments are, where employees are, or where clinics are. So one sort of step further is actually we can create we are in the process of creating a pilot at Stanford to create these tablets where patients actually can take them around and find their way in the hospital. It can also be an iPhone app that they can use to navigate their ways around the hospital, where hospitals are pretty much like mazes. So I think that would be really helpful. So that's one application of that system or software.
Okay, but now besides the patient care and experience, how else has technology been used in your day-to-day work?
So this space management system as well has a lot of reporting functionality. So in healthcare, we have to report a lot to the government and also to insurance like Medicare about the square footage of departments, because they're used to amortize assets as well as allocate expenses. So this software that I've been implementing and collecting data for has been very instrumental in creating very accurate reports that we can use for these kind of reporting functions. There's also been a lot of applications in doing chargebacks for rent, where departments previously, were not paying their fair share of rent in a building, and they were treating space as if it was luxuries, so they could actually take as much space as they want. So once we started actually charging them rent, people became aware of the cost of space, and a lot of departments actually volunteered to give back space to us so that we can better utilize them for other functions.
Okay, and would you like to build on that and maybe talk about big data?
Sure, I think one of the things that we've been trying to do is there's an incredible amount of data that gets collected in healthcare systems. Because of the electronic medical record, we have a tremendous amount of data on every patient. We know a lot about the types of patients coming into the hospital, the types of procedures that we're doing, volume of those procedures. And one of the things we're trying to do is be more data-driven in our recommendations around design, particularly about where and how we choose to invest money in our capital investments. And so we've been starting to do a lot of work around how do we pull the data out of the electronic medical record, which actually comes out in an often very convoluted and complicated way. It takes an incredible amount of sifting and cleaning, and so that's been a lot of lessons learned around how do you do that quickly to clean the data and then synthesize it and have it tell you something very simple around how large should we make a certain clinic, how much money should we invest in a new hospital that we've purchased. So we're working on actually even some potential partnerships with some students at the university, some engineering students, to look at how we can automate some of that process with the data. So it's interesting work there.
And would you like to say more about that?
Sure. Yeah, I was actually going to bring up a slide here to show this software that I've been implementing. Sorry, it's going to take a while to get there. Well, maybe we'll just talk about it. So another application where big data could come in is we can look at employee data, like their home addresses or their zip codes of where they live, and actually map it to where they work. And this is actually a pilot project I'm working on, where we're trying to figure out if there are actually less expensive real estate in the Bay Area. As you know, real estate here is crazy. So we're trying to get people to work closer to where they live, and maybe we can lease sites that are closer to where their homes are. So we're looking at big data like that to really optimize how we lease space within our healthcare system, and also improve employee retention, because people will be happier if they can work closer to where they live.
I think I'll ask one more question. We're getting so many questions here. I think we'll leave it, give ourselves time to respond to some of them. What do you see the technology of the future to be with regard to healthcare? How are we going to be impacted by that? Go ahead, Rosie.
So actually, I think one of the presentations that was earlier today was incredibly relevant to what we're seeing is the advent of genomics and genetic testing. We have some significant projects taking place right now, and it's really interesting to think about from a design perspective, not only the very technical side of supporting the lab environment that allows us to do that type of testing, so we're having to do a lot of rapid learning about how to build and design those spaces, but also on the human side of things, it's shifting from a very clinical environment to this very consultative environment, and thinking about how the design of space and consult space can support you in having some of these more sort of delicate conversations. And so we're actually in the process right now of opening a kind of a consult genetic counseling space. So it just is making us think differently about the types of environments that we provide in the hospital setting.
And then also from a tracking perspective, I think healthcare is moving towards one where a future where we can actually track patients and employees, so that patients don't get lost, and we can actually improve and make the workflow more efficient by being able to find where patients are or where medical equipment is located. So getting these sensors placed onto assets as well as people could help to improve that. We're also trying to maybe map that into a system that can actually visualize all that data, where we can also improve the utilization of spaces by tracking whether or not a workspace is being used. And that would be very helpful in helping us optimize the use of space.
Right, and one of the things we read about a lot is telemedicine, where you're able to receive your care without having to go into the hospital, and we're getting better and better tools for being able to do some very specific diagnoses at home in terms of blood pressure, et cetera, and then communicating with your physician without having to travel in some place that's very expensive as soon as you walk in the door. So I hope we get to answer all these questions, because they're great questions. And one of the first one, I guess this is the last one that came in, that happens to be my area of interest, so if you don't mind my stepping in. It's what is the role of design in mental health care? This is a huge issue, so critical to me that I've been publishing a lot in this area. Mental health facilities are among the most poorly designed facilities in the healthcare system. And they're often places you would not want to be if you were feeling completely healthy. It undermines your mental health just to be there. So we are doing things like investigating what the impact of noise is like on the individuals in these spaces. Can we provide private patient rooms for these individuals so they have a more home-like experience, or is that dangerous because you don't have someone providing extra supervision should you want to cause harm to yourself? How do you provide open versus closed nurse stations? You want the nurses to be interacting. On the other hand, a lot of violence happens in these settings. How do you protect nursing staff? It's really an incredible field that requires a lot of work, and I could spend the whole session talking about that. The next question addresses virtual reality tech.
You actually have, so this is actually a very timely question. We, as part of, I'm sorry. Do you think there may be a role for virtual reality technology in designing or testing new facilities? So it's really, we are in the process of getting ready to open our hospital expansion, and we're trying to think of creative ways that we can start to actually effectively train our staff before having access to the facility. We're actually talking right now about partnering with the School of Medicine. They have a simulation lab where they both are able to, it's actually set up as a OR room and as an inpatient room, so it feels it's real. Then they also are starting to explore the use of virtual reality as a way to test simulations, to test and kind of stress test an environment And so I think this is actually, it's a really interesting area. The work of doing real physical simulations is quite expensive. To build simulation environments takes a huge investment. So thinking about how we can leverage virtual technology, I think is a really interesting area to explore.
Who would like to field the next question?
Yeah, so the next question is Stanford Healthcare utilizing digital health products with patients to humanize the patient experience? So I'm actually a patient myself of Stanford Healthcare, and we have a subset of the primary care department called ClickWellMed, which is open only to employees, but they're piloting these digital health products. So I actually have an app on my phone where I actually can have a Skype conference with my doctor and can communicate via email or text messages within the app. And I think it's really convenient because we can just contact the doctor at any time without having to go to an actual physical appointment. And they can actually get a lot of things done that way without having to bear the cost of the actual visit.
Next question is, noise is often a factor in the hospital environment. How can you use design and innovation to reduce the negative impacts of noise? Is that something that you would like to address?
So it's actually, there's an example of a simple design change, which is actually on all of the delivery carts that we use to take meals to patients. We found that actually it was one of the greatest sources of noise was that the wheels that came from the manufacturer were really noisy. And so our food department has actually gone through and changed out all of the wheels on all of our food carts. Simple thing, but it's made a huge difference to the noise levels on our units. And so I think it's another interesting example where sometimes the simple solution is kind of staring you right in the face if you take the time to just go and look for it.
Okay. How do you assess return on investment and improved health outcomes based on these design decisions? I can jump in here for a little bit. So that has actually been a major issue in this field of evidence-based design. We will determine that there are certain things that will actually improve the quality of care or the patient outcomes, but we know that there's a dollar figure associated with that. So we have really picked this up as a way of trying to implement these new ideas by conducting these return on investment studies. There's something called the Fable hospital study. I don't know if anyone's heard of that, where we create a scenario where we introduce certain elements to a hospital that would increase the improved patient outcomes, and then demonstrated, for example, by reducing falls, right? People fall when they're in hospitals. Every time someone falls, it's this huge cost, has this huge cost impact on the hospital, $30,000 or more for each time someone falls. So by implementing certain more expensive handrail systems, we can prevent that and say in 3 years, we will demonstrate that you'll have had a return on investment in addition to reducing the suffering that your patients might feel. So this is something is not, we are completely dedicated in this field of evidence-based design to providing information based on the cost implications, both initial and as a result of this, as a means of defending the introduction of these new design decisions.
As I understand this, the Fable hospital is just theoretical. Has there ever been a hospital built that has used a lot of these findings from evidence-based design?
Well, the people in the field of neonatal intensive care are using this pretty regularly. So the issue in neonatal intensive care is they used to put all these babies in one large room. Anyone here spend any time in a neonatal intensive care unit? They can be pretty shocking environments. I don't see anyone raising their hand. They are pretty shocking environments because babies born, they come to the world, the parents had a certain expectation, and yet they find themselves in this very kind of desperate situation, life or death, with regard to their child. And the rooms traditionally were full of all the beds in one room, no place for the parents to sit, no place for the parents to bond with a child. Talk about noise, beepers going off, alarms, codes, parents very upset, and you become a part of that process because it's in the same space. And then they started this thing called single family room care, where they decided to try and put babies in their own private rooms the way they did the grown-ups. People thought, oh, babies are little, they don't need anything. But the truth is, in this setting, you're taking care of a whole family. And Dr. Robert White, who's been the leader on this, has been gathering data on health outcomes of children as a result of being in these more controlled settings. And the 2 main studies that have been published on this demonstrate that providing these more private spaces actually results in a cost reduction to the hospital. So it's something that we're very aware of and have some pretty clear examples of how it's been effective. How does the innovation impact patient medical bills? Is it affordable? It's related to that. Do you guys want to elaborate on any more?
I mean, I don't know that it makes it any less affordable. I mean, I think, in fact, what we're trying to do through sort of innovative design and improving the design experience is helping to expedite the healing process for the patients and the families, and ensure that when they are in fact discharged, that they're leaving truly healthy and ready to go home. And so,
Well, as you know, like, you might also get secondary infections going to a hospital, and a lot of these research actually show that having single patient rooms or having hand washing sinks reduces the chances of transmitting all these nosocomial infections. So actually, it does reduce the overall cost either to the patient or to the insurance. So I think even if you do it indirectly, the cost will eventually come down from a lot of the by lowering the cost of care. And also improving, the quality of healing within the healthcare environment.
Right. This is one of those fortunate, everyone here probably knows that the initial capital expense is nothing compared to the operational costs later on. It's really a drop in the bucket. So, but we can have an impact on those operational costs as you go down the road. And that's the primary argument we make with regard to that. We have 42 seconds. I see no more questions, but we're happy to talk to people later on during the reception time and give you more feedback. Thank you.